Cancer in a child is a diagnosis that no one wants to hear, but it does happen. But so many patients present late. But can this be avoided? Can patients actually present early enough to get treatment on time? This is what we will be discussing today on the Dr. Tebz Show. So this is the Dr. Tebz Show where we're putting your health back into your hands. So to discuss this topic today, I have someone who is so experienced, and he's been working at the Red Cross Children's Hospital Oncology Department, and this is Dr. Mathibe. He is a qualified pediatrician who's actually been super specializing into pediatric oncology. So he has a lot of knowledge about what we will be discussing today. So thank you so much for joining me today, Dr. Mathibe.
Thank you for having me and giving me this opportunity.
Yeah, so this is a very important topic because, you know, as much as it's rare in our population, when I say rare, it's not as common as a common cold. Yeah. But for those who it affects, it's quite, you know, drastic and dramatic. So, you know, can children get cancers?
Yes, definitely. So I know that people are surprised every time. They think that cancers only affect adults, but children do get cancers, definitely.
And what causes it? You know, people thinking, is it witchcraft? Is it someone did something wrong? Someone ate? You know, can you just go through just a few, well, general idea of what causes cancers?
Well, firstly, so cancer in children, as opposed to adults. So let's start. In adults, it's more lifestyle based and having to be exposed to certain things that can trigger that whole process of cancer. But in children is quite different. It's not really triggered by lifestyle or witchcraft or anything like that. It can just happen sporadically. What I mean by that is just it happens by chance. There have been studies where we were looking at what could be the possible causes in terms of environmental factors, in terms of what, you know, a mom that is pregnant could be exposed to that could lead to cancer. But most of those studies came up with nothing.
Sure.
But we do know that children that have gotten chemotherapy before or have been exposed to radiation. So chemotherapy is the treatment of cancer.
Yes.
So it's the medicine that kills the cancer. And then radiation is actually high energy X-rays that also kill cancer. So you will find that a child has been treated before for whatever various type of cancers, and then later on they develop another cancer.
Okay.
So those would be the most common ones. And then you will have cancers where they can be inherited. That means a parent would have a gene that has mutated, and that can be passed on to the child. Okay. So those are very few, but they are there. Those are there.
So we know that there are cancers, the common cancers, groups of cancers that happen in children, like retinoblastoma, Wilms tumor, blood cancers, brain tumors. Is there any possible way of knowing early that these children, that a child has this thing? What are the signs, let me say, and the symptoms of each of these that a parent can look out for and know that maybe there's something wrong, I shouldn't wait?
Yeah, a very good question, and it's actually very important. Let's start first with what is cancer.
Yes.
So we throw this word a lot, it's very scary, and everyone is scared. So I would explain it like, so our bodies are made up of cells, right? So these cells make up tissues that make up all the organs in our body. So the example would be a house is made up of bricks.
Yes.
Right? So those bricks are the cells, right? So they make up the house. So what happens normally? So those cells would grow in different phases, and then after a certain time they die off, and then new ones will form. So this is an ongoing process. So what happens in cancer is that these cells grow out of control.
Okay.
They get damaged, and then they grow out of control. And when that happens, then they form a mess, or they form a ball of these uncontrollable growing cells. So that mess is called a tumor, as we know it. And that tumor is what that mess is now called a cancer.
Beautifully explained. Sure.
So, and then, so what happens then? So you will get these masses, these balls of tissue in different various parts of the body. So, and then going back to now to your question about what are the signs? Because I always say that the first doctor of the child is the mother, is the father, is the caregiver, is the granny.
True.
Is the grandparent that stays with the child, because the child will not come to us if no one has realized that there's something wrong. So that's where it all starts.
Yeah.
So the International Society of Paediatric Oncology, in the year 2000, they came up with like a mnemonic, right?
Okay.
To that is now, we actually do have it in the Childhood Cancer Foundation of South Africa. So there we have like a poster that can be used by caregivers, by nurses, by doctors, because this is something that all of us, we need to learn, not just the mom or the dad that is sitting at home. So the mnemonic is called Saint SILUANE. All right, I will break it down. So as you know, that Saint SILUANE was a Russian holy hero, something like that. But then they just tweaked it a little bit. And then, so we take the SILUANE, which is RSILUAN. Right? Okay, so we'll start with the S.
Yes.
So the S stands for seek. So seeking medical help when a child now has persistent symptoms. So you see this child is coughing, or you see the child is just not well for a long time. So what tends to happen is, maybe as a parent, you don't know what's going on.
Yes.
So, but when you don't know what's going on, that's the time when you must seek help. So don't sit with a child is sick, it's just off, you don't know, and it's been a long time. So please seek help. So the I, which is like sort of like a play on words.
Yeah.
So I is for the eye.
Aha,
right?
I like
I
that.
for eye.
Yeah.
So when you see any whiteness in the eye, or a squint, or a bulging eye, or anything that is just worrying you about the eye of the child.
Yeah.
So you have to seek help.
Okay.
All right? And then the L is for lumps. So lumps can be anywhere. They can be in your neck, they can be in your face, in your scalp, everywhere in the body, in your tummy, right? So they can be on the legs, anywhere. So when you feel a lump, you do not sit with the lump. You seek help.
True.
All right?
True.
And now U is for unexplained fever for maybe say 2 weeks, right? Unexplained loss of weight. I mean, the child is eating but is losing weight, right? It's feverish, you don't know what's happening.
Yeah.
The child is fatigued, that means tired all the time, is no longer playing like they used to. So that is something that you have to take seriously. All right. And then you have A, which is aches and pains.
Okay.
So joint pains, leg pain, back pain, just pain. So we usually say it's growing pains, right? Our grannies would say, it's just growing pains.
Yeah.
So watch out.
Yeah.
So it could be something very serious.
Yeah.
So you have to look for help. And then N is for neurologicals. That means things that have to do with the brain.
Okay.
So the child is now having headaches.
Yeah.
Or early morning headaches, even more important, associated with nausea and vomiting, or just the child not having balance when walking, or if it's a developing child that was now walking and now cannot walk anymore, so they have regressed in terms of their development, right? So those are the things that would alert you that there is something wrong in the brain. So with that, you don't sit as well.
Sure.
You seek help. So that for anyone, the parent, the caregiver, the healthcare professional can use that mnemonic to just, use that just to remind themselves that we could be dealing with something serious.
Sure. I learned something new today. And I'm a doctor. Oh my gosh. I think everybody needs to know this.
Yes.
It should be known at schools,
Yes.
a creche.
Yes.
We should be having this poster ads in shopping centers or malls.
Everywhere.
Because this is very important. So now when they do pick up, one of these things and explain this, or, the neurological symptoms are going down, milestones are regressing, where can they go for help? Where do they now seek out help to say, what, this is happening? Could this be a cancer or something?
Well, the structure of the health system in South Africa is that we have the public sector and we have the private sector. So let's start with the public sector.
Yes.
Right. So you have these unexplained symptoms and you are worried. And the first place of contact is not Red Cross Hospital. So the first point of contact would be your clinic.
Yeah.
Right? Because there is demographics in terms of certain areas will refer to a certain hospital. So there will be different bigger hospitals, we call them tertiary hospitals, or your regional hospital will be your bigger hospital.
Yes.
So those are now the hospitals where the clinics or the district hospitals will refer to. But there is a process. So you go to the clinic and you explain this to the clinic nurse or doctor, depending on the clinic that you have gone to. And then they will assess that, and then you can be referred then, depending what it is, and also the resources that they have. And then you can be referred to a district hospital if there is, or sometimes you can be then referred to Red Cross with the referral. So first point of contact would be your local clinic or your local district hospital, and then from there you can be referred to Red Cross. So just there is a flow and also less overburdening of services of sort of other illnesses that could have been attended to at the clinic, and vice versa. So that would be the first point of contact. And if you are in the private sector, then you go to your general practitioner.
Okay.
Right, will be the first point of contact, and the general practitioner can refer you to a pediatrician or can refer you straight to a pediatric oncologist, depending on the findings. So that would be a path to take. Yeah.
So what can they expect when they come to a oncologist? Because now let's say they go to their clinic and the clinic says, okay, you're going to Red Cross, you need to go to that oncology unit. I mean, what can a parent expect? Because they're so nervous because now they're thinking, oh my gosh, what's going to happen to my child, you know?
So most of the time, the parent is referred to as is already chaotic.
Yes.
Is already, they are told the big cancer word, and it's already scary, anxious, and all sorts of things. So, but we understand that, and we know that. And then, so the first thing that I ask the caregiver or the parent is, what have you been told?
Good question.
So because it's going to start there, isn't it? So that, and what do they understand of what they've been told? And then from there, then it's easy for me to take it from there. Because otherwise I will be speaking over their heads or just repeating myself. But in oncology, repetition is key, right? So what they can expect would be, obviously we're going to go over the history again as to when the symptoms started and things like that. And then we're going to do a physical examination. And from that we do investigations. Obviously some would have been done already.
Yeah.
So we'll do some investigations, and then from those investigations then we make a diagnosis, and then we start treatment.
Yeah.
So treatment for cancers, because there are various types of cancers.
Exactly.
And some would need chemotherapy. Chemotherapy, as I've explained, is the medicine that kills the cancer. So chemotherapy can be given either through the drip in your vein, right? Or it can be given as a tablet, which you can swallow, or for small babies will be a syrup or a suspension because they can't swallow tablets, or it can be an injection.
Okay.
All right. And then another form of treatment would be surgery, depending if it's that lump that we were talking about.
Yeah.
The lump is in the tummy, the lump is on the leg.
Yes.
So it needs to be cut out,
Yeah.
in simple terms.
Yes.
And that is another form of treatment.
Yeah.
And then you have radiotherapy, like I've explained, is those high energy X-rays that actually kill the cancer. So some cancers will use all three, or one of those, or two of those, depending on the cancer that is.
Yeah, because it sounds like it's quite a journey that the parents are there for. So they have to be prepared that it's not going to be okay, in and out, hi doctor, bye doctor. It require them to stay for a prolonged period of time, right?
Yes, it requires, actually you're reminding me of a patient that we just had right now. So the parent brought the child, say, so doctor, when are we going to be done here?
Wow.
We are on our way. No, you see, so which is very important as to what did they understand and what do they know first. And then, so from there, then I knew that I have a lot of work to do. So then,
it's funny.
yeah, so it's that. So it's long periods of time of being in the hospital, in and out of hospital, follow-ups, clinic and things like that. And obviously all of that disrupts the child's life and schooling. It disrupts the family life, the other siblings, finances, marriages, and everything takes a strain.
Yes.
So these families and these children need support.
Yep.
And it's not just you have cancer now, we're going to give you chemotherapy,
Exactly.
and then that's it.
Exactly.
So these families and these children, they need all the support they can get.
Sure. Wow. I love the way you've just comprehensively explained this topic so beautifully. So in closing, what are your final thoughts on this topic?
So the final thoughts on this topic, obviously, us also as healthcare workers, we still have a lot of work to do.
Yep.
Of creating awareness, and it starts with you, Dr. Tebz. Creating that awareness is all about awareness. So, because if there is an awareness, so there was actually an awareness campaign in the early 2000s where they started using the Saint SILUANE campaign.
Yeah.
And what they found there was that the numbers of diagnosis of the various cancers actually increased. But the one thing that we never got right yet is the presentation, early presentation. All right. We still, yes, the numbers have increased because people were a little bit aware after that. But we still have a lot of work to do in terms of getting the patients there early on time.
Sure.
Because in high-income countries, cancer and the survival is as great as 80%.
Wow.
Because of presentation, the resources, and everything. And then in low and middle income countries, the outcomes, positive outcomes, meaning that a good outcome, is hovering around 40%.
Literally half of what it potentially could be.
It could be. And in South Africa, we are a little bit better, around 50%. But we can do way better than that.
We can do better.
We can do way better than that. But it starts with the awareness.
Sure. One word, awareness. That's all it takes.
Awareness.
I like I feel like we should call this episode Cancer Awareness.
Awareness, yes.
Because that's what is going to save people. Being aware.
It's going to save people.
Sure.
Being aware is going to save children's lives. And it's because the problem is cancer in children is rare.
Yeah.
So, but we don't want to miss it when it's there.
Happens, exactly.
Yes.
We don't want to miss
Yes,
it. And I
we
think that's the
don't want to
take-home
miss it.
message. We don't want to miss it. Sure, Dr. Mathibe. Yo, I would say thank you. Thank you so much.
Thank you for the opportunity.
No, thank you. This was an amazing, comprehensive, thorough explanation on cancers in children. Thank you so much. And to all the viewers, thank you so much for watching this episode. I hope that you've learned a lot. And remember, be aware. It's something we all don't want to hear about or know about, but it's something that we need to save a life. So if you'd like more information about this or how to contact Dr. Mathibe, please do leave your comments below, and we will leave his details in the description box. And yeah, please don't forget to like, share, subscribe, and push the notification button so you know when we post our next episode. So until next time, please do take care of yourselves, take care of each other, and remember, your health is in your hands. God bless.